Welcome. Today we're delving into a rare and often challenging lung diseases, primary pulmonary lymphoma with vascular involvement. This video will explore what this condition is, how it develops, and what options are available for diagnosis and management. The precise causes of primary pulmonary lymphoma with vascular involvement remain largely unknown. Unlike some other lymphomas, it's not typically associated with known risk factors like HV or organ transplantation. While genetic predispositions and potential environmental triggers are being investigated, more research is needed to pinpoint the exact etiology. Let's understand the how of this disease. Primary pulmonary lymphoma with vascular involvement arises when abnormal lymphocytes, a type of white blood cell, proliferate within the lungs. What sets this apart is the infiltration of these cancerous cells into the pulmonary blood vessels. This vascular involvement disrupts normal blood flow and gas exchange, leading to various complications within the lung tissue. This infiltration causes thickening of the vessel walls, potential obstruction, and subsequent damage to the surrounding lung parenchyma. Primary pulmonary lymphoma is a rare condition. The subset specifically involving the lung vasculature is even rarer. Precise epidemiological data is limited due to the rarity of the disease and challenges in its diagnosis. It can occur in individuals of any age, but it's more frequently diagnosed in adults. It's crucial to remember that this is not a common condition, making research and early detection even more vital. The symptoms of primary pulmonary lymphoma with vascular involvement can be subtle and easily mistaken for other respiratory illnesses. Common signs include persistent cough, shortness of breath, chest pain, and fatigue. Some individuals may also experience hemoptysis, which is coughing up blood, due to the vascular involvement. Symptoms related to pulmonary hypertension and right heart failure can also develop in advanced cases. If you experience any of these persistent symptoms, it's essential to consult a healthcare professional. Diagnosing primary pulmonary lymphoma with vascular involvement requires a multifaceted approach. Initial investigations often include chest X-rays and CT scans of the chest. These imaging techniques can reveal masses, nodules, or areas of consolidation within the lungs. However, a definitive diagnosis typically requires a lung biopsy. This involves taking a small sample of lung tissue for microscopic examination. Immunohistochemical staining and flow cytometry are essential for characterizing the lymphoma cells and confirming the diagnosis, as well as identifying the specific type of lymphoma. Angiography or other vascular imaging may be used to assess the extent of vascular involvement. Primary pulmonary lymphoma can be classified into different subtypes based on the type of lymphoma cells involved. The most common subtype is diffuse large B-cell lymphoma (LBCL). Less frequently, other types of lymphomas, such as marginal zone lymphoma, can also be found. The specific subtype influences treatment strategies and prognosis. Treatment for primary pulmonary lymphoma with vascular involvement typically involves a combination of chemotherapy and immunotherapy. The specific regimen depends on the subtype of lymphoma, the extent of the disease, and the patient's overall health. In some cases, radiation therapy may also be used to target localized areas of disease. Given the vascular involvement, management of complications like pulmonary hypertension may also be necessary. Clinical trials are ongoing to evaluate novel therapies for this rare disease. Unfortunately, there are no known preventative measures for primary pulmonary lymphoma with vascular involvement. Given the lack of understanding of the specific causes, the prognosis for primary pulmonary lymphoma with vascular involvement can vary widely depending on factors such as the subtype of lymphoma, the stage of the disease, and the patient's response to treatment. Early diagnosis and aggressive treatment are crucial for improving outcomes. Recent research is focused on identifying novel therapeutic targets and developing more effective treatments for this challenging condition. Emerging therapies, such as targeted agents and cellular immunotherapies, are showing promise in clinical trials, offering hope for improved outcomes in the future.